When incorporating cupping into your massage, it's essential to keep a few key points in mind. First, remember that cupping has a powerful impact on the tissues. You want your client to be both safe and comfortable. The very best way to ensure that and learn the effects of cupping is to use cupping for your self-care. Experimenting with yourself first can help you better understand the effects and the sensations, allowing you to connect more deeply with your client's experiences. Try it on everything. I've used cupping to treat plantar fasciitis, knee pain, shoulder pain, elbow pain, and to relax my upper traps. It works. Here's another tip. If you're new to cupping, as you are, go slow. Don't push for same-day results. If results come, that's great, but don't force it. As students, you are new to cupping, so start with light to medium suction and keep the cups on for a shorter time until you are more accustomed to the technique. When working with a client who is new to cupping, be conservative. Gauge the reaction before advancing to more intense applications like static cupping. Always follow the approach. Assess the tissue, apply the cups, and then reassess the tissue. Very, very important. This process ensures you adjust the treatment based on the client's response and prevents overworking the tissue. In general, it's safe to use moving cups followed by bodywork, but be more cautious when using static cups. With moving cups, think about the wave-like motion they create within the tissue and consider what happens beneath the surface due to the decompression and lifting effects of the cupping. Imagine the increase in blood flow, the boost in lymphatic drainage, and the detoxifying effects. This will help you better tune into the treatment. And most of all, have fun with the technique. There are tons of cupping techniques to play with to make your sessions more efficient and productive. Now we're going to take a look at moving cups. So you want to attach the cup with a light to medium suction. And then the most important part is to have a little lift as you move. So you want to lift up because we're trying to pick up the tissue and separate it from the underlying structures so that some new blood and lymph flow and some detoxification can start to happen. You want to move it not too fast. If you move it too fast, it's going to be uncomfortable. And if for some reason it starts sticking, you can do what's called a twist and lift. So you're lifting and you're twisting at the same time, which allows it to move a little bit more smoothly. Now I'd like to demonstrate the use of the bulb cups just by, depending on how much pressure you want, how much suction, you just pull up the tissue like that. A lot of suction, a little bit of suction. What I love about these cups, especially for lymphatic drainage, and I'm not showing a lymphatic drainage movement at the moment, but you can move it up very surface, on the surface of the skin for lymphatic, and then comes off very easily. So it works nicely in that respect. The other nice thing about the bulb cups I like is that they fit very, very nice into your hand, and you can just kind of bring them in as part of your massage technique. So we've applied some cups to the back, to the upper back, and now we're going to start walking them down the back. This is kind of a flash cupping approach. And this is the technique you would use for somebody who is a little bit too sensitive for static cupping. And this isn't quite as intense, but still very, very effective. And then you would just walk those cups straight on up the back. Okay, now we're going to take a look at something called lift and release. And if stationary cups feel too intense, the lift and release techniques offers a gentler alternative that helps lift separate and hydrate tissues. So to use this technique, you just lift for a few seconds and then release. Suction again, lift for a few seconds and then release. You could also do that with a silicone cup. Lift and then release. Lift and release. Next technique is circles. So for circles, you want to apply one of the cups. You can use 1 or 2 cups at a time. And right now, I'm just using 1 cup. I'm going to lift, and then I'm going to do circles. Another technique which is very similar to this one is just attaching a cup like this. I call this stir the pot, and then just lifting and going off in every direction, like 360 degrees. And then release. This is another technique called fish bite. So for this technique, what you want to do is take the cup, depress it like that, and then let it lift up the tissue, move to the next place. And you're kind of fish biting your way down any part of the musculature. Okay, now we're going to take a look at cross fiber and friction strokes. These techniques are used to penetrate deeper into the tissue and stretch it in multiple directions. So using one of the silicone cups, just squeeze and then release. You want to lift it up a little bit, and then we're just going cross fiber. So we can go cross fiber right in an area which stretches the tissue in multiple directions, or we can start zigzagging up and back. Always having a little bit of a lift and then going back and forth. So just demonstrating a flash cupping technique down the leg. First you put your static cups on, and then you start moving them one at a time. I'm going to stay off the popliteal space on the back of the knee.